Abdel Karim Jibawi. A lot of my patients call me Dr. AJ to kind of cut it short to make it a bit easier on them because my last name is like a tongue twister. I am currently a board-certified family physician living in Tampa, Florida. I deal mostly with geriatric patients, typically over the age of 65. And I've been practicing here for about 5 years. Well, the best part of being an IMG, honestly, to me, is the diversity, right? The diversity, meeting people from all around the world. You get to live abroad. You get to see a lot of different sites and meet a lot of different people from different countries. And I feel that makes you actually a lot stronger as a candidate, because in the medical field, we don't typically just deal with a certain group of people. You deal with a diverse group of people, and it just makes you stronger. I chose family medicine as an IMG because it allows me to challenge myself on different levels and scales in the medical field. Other practices typically tend to focus strictly on the heart or on bones and joints, etc. But family medicine gives us a broad kind of challenge that you normally don't get in other specialties. Family medicine was my first choice because I just love the fact that I am able to do, all forms of medicine into one specialty. You know what? It was tough. The program that I was in was it was the only residency program in the hospital. So we were, in the labor and delivery room and to the ER, to surgery. So we did pretty much all different types of residency. Typically, your normal residency program will send you to a surgical resident, will send you to a cardiology resident, or the fellow. For us, we did it all. So it was a tough challenge, but it was well worth it. So as a PGY resident, you got your MD, you're extremely happy and excited. You checked off one of the challenges in your life, and you go in and you think you know it all, and then all of a sudden there's a cold blue and you're completely confused. So it is extremely challenging. I think the most important aspect of this is to be humble. You'd be surprised on how much the nurses can help, how much the attendings can help. Learn as much as you can, be as humble as you can, and honestly, get there early and leave late. The compassionate, absolutely. Go-getters, you got go-getters, you have the hard workers. The compassion is what's really important in our field. You have to be compassionate and you have to care. That's what differentiates you from other people. You look into a pool of applicants and thousands of applicants who have the same exact scores, have the same letters of recommendation. We recommend so and so because their personality is great. We recommend them because they're hard workers. Your personality. Am I able to spend 12 hours in the hospital with this individual? That's how you distinguish. So we come back to the compassion and we come back to being humble. Okay. So absolutely, your personality is the number one factor when it comes to an application or starting residency. The top challenges for a family medicine physician is, I think like a lot of the other fields also, is burnout. Besides the burnout, is the documentation, the electronic medical records, the lack of staff, the staff politics, the billing, it could go on forever. So my personal advice to a lot of these applicants going into this field is to pace yourself. Pace yourself, be organized, focus. I think those three factors together is the best quality you can have in a physician. Exercise, very important. A healthy lifestyle, healthy diet. Spend time with family members, with loved ones. Don't completely focus and, completely isolate yourself with work and, extra hours. Make sure you have good quality when it comes to patient care. At the same time, you also have to focus on yourself, because you need to be healthy enough to tolerate a burnout, to tolerate all this extra work that you go through as a physician. So what you have to take into consideration is that, as the person who was on the board and the committee for hiring a lot of these new residents, is that we look at thousands of applicants who have the same credentials, okay? How personally, what I look into is the personal statement. When I was a resident, when I was an applicant and applying for residency, I used residencystatement.com because my personal statement was not the best. And that helped me out so much. So for us to get to know the applicants ahead of time, we read their personal statements. We look at their obstacles and their goals and what they've been through throughout their lifetime. And that helps us actually kind of centralize and choose the top 50 or the top 100 that we actually call for an interview. So basically, when it came to medical school choice for me, there were a lot of options. But my main decision was based on where my family members were, to be honest with you. St. Matthew's University School of Medicine in the Grand Cayman Islands is where I went to school. It's a fantastic school, and they taught me a lot. So to me, that was my first choice and only choice because my family members were all there. Personal statement is the number one. That's the only one that is able to distinguish you from everybody else because everybody has the same scores, same letters of recommendation. Who you are is what's important to us. Besides the personality and a great smile, the most important thing to me is eye contact. When you have great eye contact, it shows me that you are completely focused on this interview and you really want to be here. All right, to all the applicants who are applying for the upcoming year, do not waste your time and money on applications and programs that might not even look at your overall application. Use matcharesident.com to centralize all your information. They give you lists of all the programs who actually look at your information. So the best piece of advice I can give you as an attending is to use matcharesident.com, and I promise you will not regret it. Final words of wisdom to our IMG residency applicants community. Commitment is key. Remember that you've reached so far despite all the obstacles that you've been through, okay? I will typically, what I used to do was I would write down on a piece of paper, I got this. I will not fail. I will overcome all obstacles. Dedication and commitment is what you need to succeed in this field.